chat. But without further ado, I'm going to introduce Dr. Monica Parker. She serves as our outreach, recruitment, and education core director, along with Dr. Antoine Trammell. And she is going to introduce our speaker today. So, Dr. Parker, tell us what we have in store.
Well, it's not me. It's going to be Dr. Andrew Breithaupt who's going to talk to you. Dr. Breithaupt is a neurologist. He's one of our newest faculty members. He comes from the University of California, San Francisco, and he's got some very interesting kinds of things to talk to us about with respect to the use of artificial intelligence. You've been hearing artificial intelligence everywhere here lately. Dr. Breithaupt is going to talk to us about how this can be used to predict who's going to develop Alzheimer's and a related dementia in the future. Dr. Breithaupt?
Thanks so much.
There we go.
Thank you for that kind introduction. So my research focuses on how we can ensure that every patient, no matter their backgrounds, who they are, or who their clinician happens to be, receives the best care possible. But this is a great challenge because medical knowledge is overwhelming now. It's too much for any one physician to have at their fingertips. And so it can be really difficult to get the right knowledge to the right patient at the right time. And more recently, over the past 1 to 2 years, I've developed an interest in artificial intelligence, or AI, because I think it can help us to achieve this goal. In particular, I think it can help us to diagnose patients with memory difficulties earlier, to ensure that they have the latest care available, and that they have access to research opportunities that aim to cure their disease if they are interested in those research opportunities. And finally, I think that recent advancements in AI can allow us to reach patients through just a simple, dumb phone, not requiring you to download an app or use a laptop. So it might be able to allow us to expand access to great care. So I'll go over first difficulties with early diagnosis. This is why it's a great challenge across the country, a review of AI and how it might help, research on how we might be able to use AI, particularly in brain health, and a future vision. So one, it is a great challenge diagnosing patients with memory problems early. To understand this, I first just want to go over the progression to dementia. So if somebody is going to develop a neurodegenerative disease, they first start out normal with no symptoms, no difficulties with their memory and thinking. But when they do start developing slowly problems with their memory and thinking, but they can still completely live independently, do everything for themselves, this is what we call mild cognitive impairment. As their disease progresses, as soon as they're no longer able to do everything independently, maybe they need help with finances because of their difficulties with memory and thinking, or medication management, then this is called dementia. So first they'll be in the mild stage of the dementia. And as they need more and more help due to greater difficulties with memory and thinking, they progress to the middle stage of dementia, and then finally over years to the late stage of dementia. And I want to emphasize that we can do more to slow progression of disease, plan for the future, and advance research when this disease process is identified early. But most people who develop dementia are not diagnosed early. In fact, most are not diagnosed until the moderate to severe stages of dementia. As people across the country are getting older, there are more cases of dementia that are rising. And we're unable to increase the number of healthcare providers to keep up with this. It's not uncommon for memory centers across the country to have a wait time of a year or more. So between the time that a primary care provider refers a patient to a memory center for their cognitive difficulties, it is not uncommon for it to take a year before they see a specialist. So why is this important? There's lots of consequences with a late diagnosis. For one, they miss the opportunity to slow progression with lifestyle changes. So there are many evidence-based lifestyle changes that can slow progression of disease. And they also miss opportunities for the latest treatments available, such as the new disease-modifying therapies for Alzheimer's disease that just came out last year. And then finally, for participants who are interested, they miss the opportunity to participate in research trials that are trying to cure their disease. Why are people being diagnosed late? This has been well studied, and it comes down to two main factors. One, not enough time, especially in the primary care provider setting. They often get 15 to 20 minutes with their patients. We've tried to do research projects where we give a list of questions that primary care providers who are asking for help can go through these questions to try to diagnose a patient. There's simply just not enough time to ask all those questions. And then knowledge limitation. So not just knowing the right questions to ask, but also being able to identify a pattern. I discussed earlier how there's an overwhelming amount of medical knowledge out there now, and no one physician can know it all. So the bottom line is that clinicians need help. We all need help with providing the best care for our patients possible. And we need to try new things. This is not a new problem. We've been trying to address it in many ways for many years, about 2 decades, and what we've been trying hasn't been working. So what is AI and how can it possibly help? Well, first of all, our AI is a computer system that tries to mimic human intelligence, like learning, reasoning, and problem solving. And it's very good at finding patterns in an incredible amount of information, an overwhelming amount of information to us. And it's often good at finding patterns that we can't see. There's this new type of AI called large language models that just came out, or at least became publicly available, and public awareness was raised by ChatGPT. So ChatGPT was this large language model that came out in November of 2022, and it's spread rapidly. In fact, just last month, 3 billion people around the world use ChatGPT. But there's many other language models out there, and they're all competing with each other. And so there's been very rapid advancements in this technology just over the past 2 years. I just want to try to demystify a large language model as much as possible. The title is actually very appropriate. It's a computer model that uses language, and it is very large. So large that it learns from billions of pages of text, from books, from web pages, and it learns essentially by playing a game of fill in the blank. So as an example, the dog wagged his. I'm sure most people are thinking tail. The first time that a large language model guesses an answer, it's not going to get anywhere close. So it gets a penalty, and then it learns that the correct answer is tail. And so most large language models are going to guess tail 99% of the time. But then there are situations that are a little bit more ambiguous, such as the cat climbed up the. For people out there that have indoor cats, maybe you're thinking couch. For people out there that have an outdoor cat, maybe you're thinking tree. And this gets me to my next point, that context, but also the type of information that a large language model is trained on really matters. So if you have a large language model that's only trained on indoor cat books, it's only going to say furniture that's indoors. Maybe it won't even know that a cat can climb up a tree. So it's never going to guess that, and vice versa. So it's very important that when we train a large language model, it has a diversity of information. So what can large language models actually do that might be helpful to us, especially in the healthcare setting? Well, one, it can speak to humans in a way that can mimic other humans. It can explain things or explain complicated medical topics in a way that's easy for a patient to understand. And studies have shown that it actually does a better job at explaining complicated medical topics to a patient than physicians do. It can adapt to a person's level of education, and this is part of how it's better at explaining things. It can also speak in a way that is empathetic, and this was a little bit of a gut punch to me as a physician, but there's been studies where patients are blinded to answers that they're given from a chatbot, in this case, ChatGPT, and a physician, and they rated not only the answers that ChatGPT gave them as more informative or easier to understand, but also more empathetic than a physician. This might be because the physicians that were answering them were very busy and didn't have enough time, but in any case, that's been shown through at least a few studies now. It can also accurately translate the most common languages. So patients could speak in the language that they prefer without having to go through an interpreter. And then they can use voice to communicate. So you can imagine that this AI could interact with a patient over the phone, maybe patients that can't read or write, or patients that have disabilities that don't allow them to read or write anymore, or type. So then this raises the question, and many people have asked this question, could this be used to make care more accessible to patients of any level of education, any culture, regardless of their ability to access technology, or regardless of their language preference? What else can large language models do aside from communicate well with patients? Their medical knowledge has been demonstrated to be very vast. And in fact, their medical knowledge in many cases has been shown to outperform the average physician. So there have been studies that show that there are large language models that can get a better score on tests that we have to take throughout medical school and throughout training. And now it also outperforms the average physician on several board exams. So board exams are the exams that we take at the end of residency before we're allowed to practice independently as a physician. And so this means that it has this potential to help healthcare providers with diagnosing patients, and it can help providers access the information they need at the right place and the right time. So how can AI help with dementia care, with patients with memory difficulties, with cognitive problems in particular? I want to revisit this challenge of time and knowledge. So I mentioned that most physicians don't have enough time to hear the full patient story, and most don't have or know the right questions to ask to get to the diagnosis, or have the knowledge they need to recognize the patterns to come to a diagnosis. So I first just want to revisit the concept, or visit a concept of pre-visit questionnaires. I'm sure that most people in the audience have experienced the pre-visit questionnaire. Most people don't really like them. A lot of questions that I often hear people ask me, not in our clinic. I think we do a good job of actually reviewing our pre-visit questionnaires in our clinic, but in most clinics, patients get the sense that their physician is asking them the same questions that they already answered on the pre-visit questionnaire, and so then they wonder, why did I even fill this out? And then I've also had people tell me that they get frustrated with these pre-visit questionnaires because it kind of confines them to a yes or no answer or multiple choice. And they have to get kind of cornered into answering a question as best they could, but doesn't really get at what their symptoms are or what they're experiencing. So the question is whether or not AI might be able to do much better than a pre-visit questionnaire. In fact, could AI, with unlimited time and knowledge, do as well or better than a clinician in getting the full story and symptoms from patients? And then going a step further, could AI use the patient's story as well as other data to help clinicians identify patients with concerning memory problems early on? So put a little bit more succinctly, could AI help to collect and understand a patient's story and symptoms? Let's revisit this progression to dementia. Ideally, we'd be able to capture patients as early as possible, as soon as they or a loved one or friends were noticing changes with their memory and thinking, maybe even before they schedule a visit with their primary care provider or another physician, they could go ahead and get this interview with AI. The AI would be able to summarize it, be able to put, even if it's an hour-long interview, put this interview into a summary that is easily interpretable to a physician, such as a primary care practitioner. And then this AI assistant tool might be able to help that primary care practitioner identify patterns of concern and provide some suggestions for next steps, such as a cognitive test, blood tests. There are most physicians around the country don't know about the latest blood test that can help to diagnose Alzheimer's disease, for example. The type of imaging that would be most helpful with coming to a diagnosis. And then maybe this could be managed with a primary care practitioner if they feel comfortable with it, and the AI assistant tool could help them to ensure that they have the latest evidence available to them, that they are providing the patient with the latest treatments available, as well as research opportunities. If they feel uncomfortable with it, then they could refer to a specialist who would also be using an AI assistant tool to ensure that they're providing the best care possible, that they're bringing the latest evidence that we have available to that patient to provide their care, as well as, again, research opportunities that a patient might be interested in. But there are many challenges with AI. So for one, they can make mistakes. And one of the questions we're trying to answer, and people have been already doing studies on, is can we predict them and then avoid them? And do they make less mistakes than clinicians? So there was one imaging-based study that found that when a clinician is working together with AI, that combination does better than the clinician alone or the AI alone. That was just one study. It was an imaging-based study, so we'll have to replicate this in other use cases. The other challenge is privacy. So we can't just use ChatGPT, this publicly available knowledge, because that information goes to the company that owns ChatGPT, and we wouldn't want patient health information going there. We want it to stay within our confines to make sure that it's completely confidential. So we have to use different large language models that we can use within Emory and ensure that that data never leaves Emory or another health institution. And they can show bias if they didn't learn information from a diverse group of people. So you might remember that example I gave of that cat climbing up. It depends whether or not the model was trained on indoor cat books or outdoor cat books. It needs to be trained on a diversity of information. And safety and effectiveness can only be established in groups of patients who participate in research with it. So that's why it's really important that we have that patients of all different backgrounds participate in this kind of research to understand if it can help them. So only through research studies with diverse participants can we understand if AI is fair, effective, and safe for everyone. So we'll be looking at how accurate AI is at gathering a patient's story and their symptoms compared to a specialist. We'll also be looking at how well it does with suggesting an intelligent, a good differential diagnosis to make sure it can steer or at least help clinicians go in the right direction with diagnosing patients. We'll be looking at bias. Will AI's accuracy change based on a patient's demographic? For example, their education level, their age, their race, their wealth. And most importantly, are patients comfortable and their informants comfortable with this? Surprisingly enough, or at least it was surprising to me, there have been multiple studies that have been done on the kind of older chatbot or conversational agents that were not based on large language models. So kind of the wonky chatbots, and actually many of these studies found that patients were comfortable with these chatbots, but even more so, they were sometimes more comfortable with divulging personal information to a chatbot than to a human, at least with mental health. But these were small studies, and so we certainly can't just rely on these. And through the research studies that we'll be doing, we'll be looking at this question. So finally, I want to end on the idea of this being able to improve the patient-provider relationship. And this, this idea of getting the history ahead of the visit is something that we already do actually in academic medical centers. So when I have a medical student or a resident come to rotate with me in the memory center, I give them a list of questions that they can go through with the patient. And they alone spend time with the patient, maybe sometimes even 45 minutes to an hour going through all those questions. But if they go through all the questions, they can get 95% of the information that I need to get to a diagnosis. So they come out of the room and they summarize everything that they collected from the patient. And then when I go in with a medical student to see the patient, then I'm able to confirm the main findings within about 10 to 15 minutes. And that gives me a lot of time back to the visit. So instead of rushing through the visit, sometimes uncomfortably having to steer the patient back to the relevant topic so that I am not too late for my next patient, instead of having to do that rushing, I have time to get to know the patient a little bit more. I can understand their values. I can understand what they like to do, what they find meaningful in life, which really helps inform shared decision-making. It helps to inform what steps to take next, what interventions they might be most interested in. It helps to ensure that we're going on a care pathway that is most meaningful to them and that's in line with their values. And so usually when I do have a medical student or a resident that collects this history ahead of the visit, and I confirm it with a patient, it's those visits where I feel closest to a patient at the end of the visit. And I've gotten comments from patients that those are also the visits where they feel like they've really gotten closer to their provider. So I think that these kinds of tools can help us not only ensure that we're diagnosing patients as early as possible and getting them to the right diagnosis, and not only that we're ensuring that they get the best care possible, but also that we're ensuring that we can try to improve the patient-provider relationship, which I think is currently hurt by how much we have to rush to get through as many patients as possible. So with that, I want to thank you and open it up to questions.
Excellent presentation, Dr. Breithaupt. Excellent. I know we're going to have a bunch of questions in the chat. Dr. Trammell is going to come on and kind of start the conversation. But if you are tuning in and you have questions based upon Dr. Breithaupt's presentation, please send them in the chat in the Q&A, and he will be more than happy to address them. Dr. Trammell, talk to us about Dr. Breithaupt's presentation and your thoughts.
Hey, everyone. Drew, awesome work. Um, One question that popped up in the chat, which I thought to be rather interesting. Someone mentioned that they heard AI can hallucinate. Um, can you give us any insights about that? Have you heard anything similar?
Yeah, it's a great question. And so, these hallucinations is when you ask AI a question and then it gives an incorrect response. And a lot of these hallucinations have popped up in scenarios where people have kind of described it as if it's maybe a really competent intern, but an intern that really wants to please and just can't say, I don't know. And so they just make up an answer instead. So that's the way that most people think of it. And there's been a lot of clever techniques that have been done to significantly reduce these hallucinations over the past 2 years. This is something that's really improving. So the hallucination is not like some kind of visual hallucination or delusion or anything like that. It's basically just means that the answer is incorrect. This kind of gets back to that question of when are they incorrect? When do they make that mistake? And can we predict them? And then can we do things to eliminate those mistakes? I don't know that we'll ever be able to do that, to be able ever be or be able to ensure that they are accurate 100% of the time. And that's why I want to make sure that there's a physician in the loop. But there have been recent studies over this past year that have come out to show that in many cases they can make less mistakes than a human, and in many cases even a physician. Again, these are different use cases, and so we'll have to see if it's can make less mistakes than a clinician, and especially that combination of a clinician with AI. Maybe there will be less mistakes, but that's something that we'll need to prove through research.
Wonderful. What about opportunities for people to be involved in research that involves AI?
Yeah, I got a question about this from one of our research, someone who's involved with research at the Goizueta ADRC, because right now the way that we're designing this is only patients who will be seen at the clinic and get a full interview by a specialist will be participating, because we want to be able to compare the interview or the symptoms that AI collects from that patient to the symptoms that the specialist collects. But there's been a lot of interest, which I really appreciate. And so I'm actually trying to come up with a way that for people who are not being seen as patients, maybe they don't need to be seen as patients in the memory center, that they can participate and help us to improve this, AI conversational agent, our chatbot, so to speak. So if there are any ideas, I would love to hear them, but that's something I'm trying to brainstorm and work on.
Okay. Well, there is trying to keep up with the questions that are coming in. All right, so someone asks or says the AI is not an exact science, plus it has to be programmed to be safe. What about a light called 10,000 lux for dementia patients to help sundowning? Are you familiar with that?
No. 10,000 what?
10,000 lux.
Oh, a light called 10,000 lux okay. I've heard about that a long time ago. But I'm not up to date about it, so I don't feel comfortable informing the audience about how useful that is.
Very well said. All right. And how can we use AI to help in the prevention of dementia? So as you approach that answer, Drew, I think it may be good to differentiate, once again, mild cognitive impairment from dementia.
Yeah, so dementia, or starting with mild cognitive impairments, that's kind of the first stage. That's when you or a loved one notes changes with memory or thinking. We confirm those changes on cognitive testing. So we show that there is actually a problem with memory and thinking, but you can still live independently. It's not affecting your day-to-day life. When it gets to a point where it is starting to affect your ability to live independently, that's when it's called dementia. And so with this project, what I kind of the use case that I went over, identifying a patient as early as possible, it's all the promising therapies that are in the pipeline, or even the therapy that just came out last year for Alzheimer's disease. All of these therapies have to be given as early as possible, ideally in the mild cognitive impairment stage, early on in the mild cognitive impairment stage. When we give these therapies late, they're not effective. So the idea of the first step is really identifying this disorder as early as possible, and then it opens up possibilities to slow the progression, and through a lot of the research trials that are going on right now, hopefully prevent dementia from ever happening.
Good. So at what point should we consider using AI in conjunction with a provider to determine whether or not someone has possible memory challenges?
Ideally, as soon as they start noticing any changes with their memory and thinking. I think ideally for physicians like us that specialize in these disorders, if we could see the patient as soon as they start identifying changes in memory and thinking, we would know what to do earlier, because we know what questions to ask. We are given a little bit more time to ask those questions and figure out what's going on. And so there are other ways that we're trying to develop to identify patients even before they start developing symptoms, but we don't have a clear-cut way of doing that yet. So for now, we really rely on patients being able to tell us as soon as they start noticing changes with their memory thinking.
Okay. I have some additional good questions here. There was a story on 60 Minutes about people using educated people in other countries to teach AI to identify or correct their mistakes. So how will the medical community make corrections with AI or to AI with information on patients? So in other words, like once we see a mistake, how can a correction be made?
Yeah. So it's, in this case, let me give a little bit of background, because that's a big topic in and of itself, of using people all around the world, paying them to correct these models. That's kind of, when you're first creating these models, we call the foundation of the model, so kind of the base of the model. And that's what's going on with educated people, kind of correcting it, with giving it, correct mistakes or correcting their mistakes. We in the medical community, and a lot of these studies that have been going on, is using a model that's kind of already been made and then making further corrections, so kind of further fine-tuning it. There are many ways to do this. Some ways you can correct the mistakes is just by telling the model, whenever you see this pattern, from now on, don't do X, that was wrong, do Y. That's kind of the simplest way. It also depends on the type of mistake. So if it was an information mistake, if it was a factual mistake, then we can tell AI, hey, always go to this textbook, for example, and try to get information from that textbook before providing information. And that way it'll be more accurate. But then there are also ways that we can make it better at identifying patterns. And in those cases, we can try to give it kind of gold standard examples or gold standard patterns, many different examples. And we can feed it to AI and make it learn that way. So we could have a 2-hour talk just on that concept alone, but there's many clever techniques that industry is coming out with, and the academic centers are coming out with to further train a model to do a better job.
Okay. Now, since we're talking about large language models, machine learning in that sense, is there a way that they can detect physical symptoms like appearance differences or abnormalities in a person's appearance? I guess a good example might be, say, a facial droop, one who's had a stroke.
Yeah, that's a great question. Right now, they're not doing that very well. There are examples where some of these very big large language models were accurately able to describe a video of a surgery and accurately able to describe the anatomy. But that was because it was trained on a lot of videos that were doing those types of surgeries. So one of the things that I'm particularly interested in is, but this is kind of a down the road thing, is if we can collect more images or videos of patients who have a stroke that cause a facial droop, for example, are patients who are developing signs of Parkinsonism. So you can have different, your voice or your face can change based on Parkinsonism. If we have enough of that data, we'd be able to train AI to identify it very early on. So that's a possibility, but that kind of technology or that kind of model that's able to do that very well isn't currently available, but I think it's very promising that we could get there someday.
Okay. Someone asked an extremely important question. What about insurance coverage for using AI to aid diagnosis?
Yeah. There are different ways of doing this. So there are demonstrations now. There have been AI products that help with diagnosis. And there's particularly one that uses, it scans the back of the eye of a patient to help with diagnosing a certain condition. And that AI company has gotten the approval to get reimbursed whenever a provider uses their instrument, their AI tool. So that is possible. In this case, though, if we're trying to aid the clinician in a workflow that they already have, then it might be that the healthcare center, the healthcare system themselves, pay for this tool, just like they're doing with ambient scribes. These ambient scribes is this kind of AI tool that listens to the conversation, the interview between the patient and the provider, and then summarizes that conversation for the provider in their note. Lots of healthcare centers around the country are paying for that because it reduces burnout for physicians, and it seems to help the visit between the patient and the provider more. So there's kind of already a movement of trying to help clinicians and patients maximize their time together in their appointment.
Okay. So, in addition to insurance coverage, at this time, are there any medically approved AI programs that can help in diagnosis? And honestly, is the FDA even involved in this?
Yeah. So the FDA, one of the big medical journals that a lot of clinicians look at is JAMA. It's a very highly peer-reviewed journal. And the FDA commissioner just wrote an article about this, I think it was about 2 or 3 weeks ago, and was interviewed by one of the JAMA editors. And so the FDA is getting involved. They've approved, these are not all for diagnosis, but they've given approval to a little over 1,000 AI tools at this point that can be used in healthcare. And that number I think just 2 years ago it was only 500. So this number is really growing fast at this time. But the FDA is trying to work with the medical community to do these approvals and make sure that even after they're approved, with AI, it's particularly important to continue to study and monitor it after it's been approved, because the performance of it can change over time. So it's different than a drug where we expect that its performance is going to be the same for years to come. With AI, its performance can change over time. So the FDA is trying to find a good system where it can enforce that monitoring of the AI tool constantly for many years to come. But there's lots of other topics to talk about there, but I think those are the main ones that the audience might be interested in. Yeah.
Well, you know what? That's definitely one of the challenges of evolving technology is monitoring, because if there are 1,000 programs out there, that's going to be a monumental task itself. Like, how do you monitor all of these programs, and how can you really ensure that there's good quality? Because we don't want bad programming, in the marketplace, and certainly not in clinical settings.
Yeah. Yeah, it's been a problem before. Yeah.
Oh, yeah. So on that note, are there any ethical guidelines that are in place or being developed when it comes to using AI in this regard?
Yeah, so lots of ethical guidelines out. Well, I should say lots of ethical guidelines that are being created by different groups. But I think there's pretty widespread agreement on at least a few things, that it should be fair, that it should be accurate, that it should be effective, that it should be safe. Those are common themes that are across these different papers that are written, whether it's a paper from an academic journal where ethicists in the healthcare field who are also in the field of AI write a paper about the ethical implications of this technology. And then there's also there's a big government agency that looks over healthcare information technology, and they just wrote a very, very long paper about this, and that gives guidelines on the ethical use of AI. And so it's a topic that is still changing over time as the technology evolves. There will be there are new challenges that are arising and things that we need to be thinking about. So it's I think that each time a guideline comes out, we're going to have to continuously be evaluating whether or not it's sufficient. I expect that there'll probably be a new guideline, every couple of months or at least every year.
Well, I mean, hey, if that's what we have to do, then that's what we have to do.
Yeah.
So when information is collected via AI, who does it belong to? Does it belong to the healthcare provider? Does it belong to the company? To the patient? Whose information is it? Because that's a matter of patient privacy and HIPAA, right?
Yes. Yeah, absolutely. A huge question that's coming up in industry and especially in the healthcare field, because now data is more valuable than ever. So people are calling data gold. And this is another ethical issue of, I have my personal opinions about it, but there's conversations going on about whether or not if healthcare data, if patient data is de-identified, and then should AI companies be able to pay for that data to improve their models if those models will help patients in the future? And so I think I don't know if there's really, this might just be my ignorance, but I haven't really heard of a clear consensus there. I think that, anecdotally, and this is kind of my bias, but most people I talk to who are in this field, we don't think that should be allowed, that this healthcare data really needs to be protected. But, it's, I'm sure my opinion and others' opinions will evolve as the landscape, evolves and this field grows.
So now moving on from more of the regulatory aspect, is AI able to be used to differentiate medication causes of cognitive challenges?
I think that's a really great research question. And, I kind of alluded to, and Dr. Herbal and I have talked about this before, but of AI being able to use more data than, be able to use both the patient history, but also data available in the electronic health record. And so my hope is that it would. But that's that's a research question that we'll need to figure out, because the medications that a patient is taking, that's something readily available in the EHR. And so the thing that this AI or even kind of simpler computer systems can already do is say, tap the physician and say, hey, this patient is taking a medication that can really, they're an older, that maybe they're an elderly patient with cognitive impairment already diagnosed in the electronic health record system. They can already tell us this patient's taking a medication that's not good for their cognition. You should try to de-prescribe that. So I'm optimistic AI would be able to, but it's tough because, even for specialists, it can be difficult for us to know whether or not their cognitive symptoms are just due to a medication or if there's something else that could be going on. So it's a tough one. Yeah.
Thinking about one of your slides, you talked about the point at which AI would be used and how it could even potentially partner with the person's PCP. So, that's diagnostic, that's developing a care plan, but can it be incorporated into the treatment process? Can it be used to support or prevent an ongoing decline in memory and thinking skills? Let's say you have, and this is based on a question, an adult who is in their 90s. Can it be a form of companionship, which is critical for older adults, as being around others is in fact a protective factor against memory decline. So
Yeah.
long questions. Basically, can AI be used as part of the treatment to prevent ongoing loss?
Yes, and it's interesting. There are companies that are already doing this and have been doing it even before large language models. So there's a company that's based in the Bay Area, and they actually have. It's mainly for um, patients that need a lot more support. And it's not just patients with cognitive impairment. Most of these patients have mental health disorders, and need that companionship as well. But so they created on an iPad. They use an iPad, and there's kind of an avatar, meaning that there's an image of I think it's actually a dog, cute looking dog that can talk with them, and that can remind them to take medications. One of their more recent projects is it can actually do physical therapy with them because it can detect how they're moving around and tell them, great job, you're doing the physical therapy well, or might need to pick up that right leg a little bit more for your physical therapy for your walking imbalance. And the data that they're collecting, they can give back to their primary care provider. And so even if that patient is not reaching out to their primary care provider about something, maybe they're too busy or it slipped their mind, then the data that this machine or computer system is collecting, they can go ahead and feed it to the primary care provider and say, hey, they're starting to breathe a little bit heavier. You might need to get someone to come out there and check on them, or they're forgetting to take these medications. Maybe we need to get someone to come out and help them out with this. So there's interesting projects like that honestly I wouldn't have thought would work, but it seems to be working well. And there are simpler ways to do this as well. I mean, you can imagine a system that calls a patient maybe once a week or once a month to check in on them, especially after they were just switched to a new medication, and ask them, are you experiencing any of these side effects? And if so, then they send that information to their provider to change it, nip it in the bud before it really becomes a problem. So I think there are so many opportunities for optimizing that treatment path, that management. And that's, a whole other area of research that we really need to explore.
You know what? We are almost at time. I'm going to try and squeeze in at least one more. Are you aware of any research on AI crossing with DNA-based family history databases like 23andMe?
Of using the DNA information.
Like cross-linking any data generated from AI programs with DNA information.
Yeah, so there are I've heard there are even companies that are doing this, but I don't have a lot of information about that. That's kind of third-hand knowledge, but there definitely is research going on. One of the first things I was talking about with AI is its ability to identify patterns with an overwhelming amount of information. So you can imagine that if it is taking the information in about the patient's history, the information that's already available in the electronic health record system, but then they're also using their entire DNA, their entire genome, then maybe it can find patterns that we can't, to provide that patient with, we call it precision medicine, healthcare that's more precise for them. And I just wanted to end with saying that, this field, I've been told by people who know way more than me about this field, there is no one person that knows everything. The information out there is evolving so fast. And so if anybody identified something that I said that was incorrect or outdated, something I want to know, please let me know, because it's certainly it's very possible given how fast this field is advancing, and I'm trying to learn just like everyone else in the audience is trying to learn.
Well, we certainly thank you for sharing what you do know with all of us.
Thank you.
Right.
Thank you so much, Dr. Breithaupt, Dr. Trammell, and thank you for such an enlightening and engaging presentation. Thank you to our audience for sending such great questions. We were able to fill the time and answer all of them.